Good morning, everyone, or good afternoon, or good evening, depending on where you are in the world. Welcome to this webinar on the role of social protection during the COVID-19 crisis and also the recovery in the region of Asia and the Pacific, which was organized by the ADB and hosted here at socialprotection.org. My name is Camilla, and I'll be your moderator for this event, and I'm super honored to be able to participate, given we have here many great professionals and researchers in social protection that can provide us with amazing insight on social protection in the region of Asia and the Pacific. So we have people from officers from international organizations such as ADB, ILO, and ASCAP. But I think before I begin introducing these great names and begin to explain how the webinar is going to work and all of this more bureaucratic part, I'd also like to invite you to join us at the Asia Pacific Social Protection online community at socialprotection.org, where you'll find this event's recording, presentation, suggested readings, and many more information on the upcoming events and other important information about Asia and the Pacific. So the link is available in the chat, and so please just feel free to click it and join the community. So without further ado, let me start explaining how today's session is going to go. Today, we're going to have two incredible presentations on two different studies developed by ADB on social protection during COVID-19 crisis and recovery in the Asia and Pacific. So the first one is a costing exercise on the undertaking for 30 studies in Asia and the Pacific to estimate the social protection costs through various stages of the pandemic, projected up to the remaining duration for achieving the Sustainable Development Goals in 2030, which will be presented by our colleagues here, Arthur van de Meerendonk, together with Anand Ramkumar, which were both authors in this engaging study. And the second one that will be presented today is a study on how COVID-19 has affected labor markets in Southeast Asian countries such as Indonesia, Malaysia, the Philippines, Thailand, and Vietnam since the beginning of the pandemic, and helps to identify priorities, constraints, and opportunities for developing and implementing effective labor market strategies during the economic recovery and beyond. Also presented to us by author Samir Khatiwara. And after each of these presentations, we'll also have discussions, questions Dietland from ILO and Selahattin Selsampasali from ASCAP, which will be providing their insights on their studies in question and also presenting some of the related studies from their own international organizations that can contribute to this discussion on social protection during COVID-19 crisis and recovery in Asia and the Pacific. At the end of the final presentation, so at the end of this webinar, we'll also have a Q&A session where you, our audience, can interact with the speakers by sending us your questions at the Q&A box. So the Q&A box down here on Zoom. So feel free to, as we go throughout the webinar, you can send us your questions, and then the speakers at the end can answer to them. And also they can interact among themselves and discuss a bit more on the future of social protection in Asia and the Pacific in this post-COVID-19 scenario. So now that we've established the dynamics for the webinar, I think we can properly present all the participants of today's event. So let's start with Arthur van de Meerendonk, which is a senior consultant in social protection and financing for the Sustainable Development and Climate Change Department from ADB. He holds an MSc in economics and also an MA in philosophy, and has 20 years of experience in government organizations such as helping Dutch ministries, but also the ILO. And he was involved in many welfare state restructuring operations in the Netherlands. Currently, he also advises government organizations in organizing, purchasing, and delivering social services. And he acts as a consultant for international organizations such as ILO, UNICEF, and ADB, which he will be representing here today. Besides Arthur van de Meerendonk, we'll also have Anand Ramkumar, who is also a consultant in social protection for the same ADB department, where he provides research, capacity development, and operational support on social protection initiatives. He holds a master's degrees in public policy and human development, and has a specialization in social protection policy. And he has worked supporting governments and development organizations in designing and implementing social protection systems. The last of our speakers is Samir Khatiwara, who is a social sector specialist at the Southeast Asia Department at ADB, where he leads preparation and implementation of ADB loans and technical assistance projects in areas of education, skills development, social protection, and jobs. Previously to ADB, he also worked for 10 years at the ILO, and he holds a PhD in economics as well as a master's degree in public policy. On the discussant side, we will have Celso Basali. He's a social affairs officer at the UN SCOP. He has a PhD in development economics and currently works on social protection and leaving no one behind. And he's also the focal point for SCOP's social protection simulator, which also simulates the impact on social protection schemes on poverty, inequality, and consumptions in countries in the region, and that he will be giving a little bit more on that throughout the webinar for us. And our final discussant is Christian Dietland, senior economist for the regional office for Asia and Pacific of ILO, which is the international organization in which he has worked since 2011, although in different offices, such as the research one. And his research focuses on labor economics, the future of work, international trade, global supply chains, and macroeconomics. And currently he has been undertaking extensive research on the labor market impact of the current crisis. So he'll be able to give us great insights on how labor markets were also affected by the COVID crisis. And finally, just to introduce a little bit more about myself, I'm Camilla Holling. I work as a researcher at the IBCIG International Policy Center for Inclusive Growth. There, I've worked mainly with supporting projects on social protection in Latin America and the Caribbean, but most of them focused on the region's social protection response to COVID-19. So I had a key role in mapping the social protection measures implemented in LAC for the socialprotection.org dashboard that we have, and also a panelist at the Inter-American Conference on Social Security, presenting a little bit more on the development of the pandemic and the response of social security institutes in the region of Latin America and Caribbean. So I'm extremely excited to be here and also be able to engage a little bit more with the COVID-19 debate, more focused on Asia and the Pacific. I think it's important to note that the COVID-19 crisis had an impact in the whole world, and the Asia and the Pacific region was no different. It was heavily hit by COVID's social and economic implications, affecting many of the population, especially those already marginalized by structural barriers in gender and wealth inequality before pandemic, such as elderly, women and girls, children, people with disabilities, migrants, and informal workers, which were also affected by the effects of the crisis in the labor market, and that were not protected when the crisis came. So in this scenario, social protection, especially in Asia and the Pacific, but in the whole world as well, it was a key pillar in protecting those that were being affected or were left unprotected during the crisis. So governments in Asia and the Pacific implemented sizable fiscal packages and worked on providing a significant social protection response to expand their coverage of their systems to other uncovered population and help to protect them during the crisis. So social assistance programs, especially cash transfer programs, played an integral role through horizontal expansions, as well as active labor market policies that played an important role in the response. So in this sense, social protection can have an important role not only through the crisis, but also throughout the recovery, helping to provide protection and stimulus to the population. And COVID-19 has provided us with an important opportunity for policymakers to reevaluate their investments and strategies. So this webinar intends to, besides sharing the results of these two studies and other studies from ILO and ASCAP on how to better appreciate the role of social protection during COVID-19 crisis and recovery, but to draw attention to the significance of the necessary upfront planning required to develop robust social protection systems in Asia and Pacific, considering the foreseeable demand for protection for large sections of the population in the future, but also to start brainstorming about towards this goal in Asia and the Pacific and bringing together relevant stakeholders in the region to collaboratively plot a way forward. So without further ado, I would like to ask Mr. Arthur van der Meerendonk and Anand Ramkumar to present their studies on the costing exercise they've developed for ADB. So please, let's start.
Thank you, Camilla. Can everyone hear me? All right, great. Thank you so much for that introduction, Camilla. And we're very grateful to have this opportunity to present the results of our costing exercise. And this is just one of the knowledge products available in the region to help countries plan better and better look at re-strategizing investments and planning and development of the social protection systems in the coming times. Can we go to the next slide, please? So just to give you an overview of how the presentation is structured, we'll first go through some of the contextual settings, the COVID-19 scenario in Asia, its impact, the pre-COVID-19 social protection levels in Asia and the Pacific. We will not dwell too much into the immediate policy response, but we've kind of used the policy response to help guide some of the modeling choices adapted for the costing exercise. We will go a little bit in depth into it when we go to the other slides. Next, we'll go through the costing tool itself. We've used a new costing tool called the Social Protection Reform Simulation Model, otherwise referred to as SPRS-20. We'll guide through some of its modeling architecture, the scope of the current costing exercise, and some of the programs and parametric choices adapted for the different packages that we modeled for this costing exercise. And finally, we will run through the results and findings that were generated as a result of this costing exercise, and discuss a little bit further on how to take this research forward. As Camilla mentioned, there's a lot of ongoing work from different agencies along similar lines, and it's a great opportunity to bring all of the thinking together and to help countries better prepare for future shocks. Next slide, please. All right. As Camilla broadly touched upon in the introduction, the pandemic, as with the rest of the world, continues to unfold in Asia and the Pacific, and its implications for this region is particularly drastic, considering that a huge section of the vulnerable population in the world reside in countries in the region. And it stands to undo a lot of the important work done in alleviating poverty, improving well-being in the region over the last few decades. Social protection systems play a very important role, very crucial role through this time. And it's very evident if you take a look at the kind of responses countries have had and the size and scale of the social protection programs introduced in response to the pandemic as part of the overall country policy packages. The pandemic not only triggered a huge social protection response, it's also kind of exposed gaps and challenges in the social protection systems in the region. As millions more who were previously not dependent on social protection systems became all of a sudden dependent on limited resources and limited capacity of systems, and an extended requirement for coverage and protection became evident almost in every country. So this also provides a very important opportunity for policymakers to reevaluate their investments, reevaluate their strategies, look at ways in which they can better prepare for the future, as well as better prepare probably larger sections of the population who will need added protection going forward. Next, please. So according to the Asian Development Bank's Social Protection Indicator, which is a tool for assessing social protection effectiveness within and across countries, the pre-COVID-19 social protection levels, the coverage levels, was extended only for about 55.1% of intended beneficiaries in Asia. In the Pacific, this is even lower at about 31.2%. The coverage figures alone is evidence enough to show us that such a huge percentage of the population was outside the scope of social protection systems when the pandemic hit. And if you look at expenditures, on the other hand, average expenditure stood approximately at about 5.3% of GDP in Asia and about 6% in the Pacific. Although this average kind of hides variations between countries, it also draws questions on the effective utilization of this expenditure. And this is something that probably countries will have to evaluate as they go forward as well. With such low coverage in the region, countries also struggled, as we saw in a lot of the response and a lot of the knowledge products and initial studies that were coming out about the social protection response, that countries struggled to reach those in need. And not just to mention that in addition to those who were already vulnerable, COVID-19 added a huge population of those newly vulnerable. And countries struggled to identify those newly vulnerable and reach them effectively. Next slide, please. So given this context and given this backdrop of COVID-19 and foreseeing significant demand for added protection in the future for large sections of the population, this costing exercise that we've developed, it takes a look, it uses this the SPRS-20 costing model, the newly developed SPRS-20 costing model, to estimate costs associated with delivering social protection packages through different stages of the pandemic. There's a different logic underpinning different stages. So for the purpose of this exercise, we've divided the stages into three: the emergency phase in 2020, an anticipated recovery and transition in 2021 to 2023, and then the remaining duration of for achieving the Sustainable Development Goals, which is from 2024 to 2030. Now, each of these phases is accompanied by a social protection package customized for that particular phase. For the first two phases, the emergency and recovery, we've tried to model the packages based on the actual responses that we've observed in the region. And these are additional costs to the system on top of what is already probably planned expenditure in these countries through this, at least through 2020 and the rest of the years. For the third phase, which is the social protection floor phase, the model uses a much more comprehensive package. It has a lot more measures and is in line with the ILO recommendation for social protection floors. So, and this is envisioned as as a total cost to the system, not just additional cost, but this is estimated to be the total cost to the system through this period of time. The aim here is to trigger discussions, collective brainstorming, and research in the region, and to bring stakeholders together to start putting all of these ideas together and planning together to generate more knowledge and generate more research to help countries in the region undertake better planning for social protection for the future. So just to give you a quick overview of the SPRS-20 model, SPRS-20 is a comprehensive social protection costing tool. For the current exercise, like I said, it helps achieve two kinds of modeling. So the first one for the two phases, for the emergency and the recovery, it looks at additional costs to the system. And for the third phase, the social protection floor, it also helps estimate a comprehensive social protection floor, the cost of implementing a comprehensive social protection floor. And it offers a wide range of customizability. The social protection, the dashboard, the program dashboard in the model allows you to choose between over 20 programs that you can add to a country's package. And at the same time, do a lot of program level customizations, looking at benefit levels, how you would like the benefits to be phased in, what kind of benefit adjustment mechanisms would you like, the target population, and other such criteria. It also allows users to model different scenarios based on country parameters. For example, vary employment rates, vary unemployment rates, poverty, informality, etc. So it offers a lot of customizability for the user to kind of evaluate different scenarios and the costs associated with different scenarios. So the idea is that it should provide enough freedom to policymakers to weigh each policy option that they're considering in their country. And hopefully SPRS-20 provides this sort of a platform for policymakers and for users to evaluate such costs and look at different scenarios and how these costs might vary in different scenarios in their respective countries. Next slide, please. Okay, I'd now like to hand over to Arthur, who is essentially the father of this model. to kind of give a brief idea about its modeling architecture and the rest of the details. Arthur, on to you.
Thank you, Anand. Yes, let me briefly explain a little bit about the model architecture. Basically, the model is sort of built in a tradition of the ILO's social budgeting way to model social protection systems. But given the fact that we built the model for as a policy tool to be used in many countries, we didn't use national data to fuel the model, to feed the model, but we used international data. So we used IMF, World Bank, ILO, ADB data, World Health Organization data. This helped us to have a database which across countries would be comparable. So basically, as you can see here, you see a number of parts of the model listed here in this graph. The green parts are basically is basically the fuel which fuels the engine of the model, so to say. So those are the data from international sources, which can be updated each half year or each year, and they fuel the model. And basically the engine of the model is the blue and the red part at the core of the graph here. So those are the specific modules which model parts of the entire system. So you have a population labor force part, you have an economic part, and you have a public finance part. Actually, the last part is still work in progress. Then moving slightly more to the right of the graph, you see the orange and the yellow parts, which actually are the different models. So like Anand already mentioned, the total model allows us to model more than 20 types of programs, and basically there you have your model dashboard, so to say, and your outcome graphs and tables. Let me move to the next slide, please. This is basically two screenshots, two parts of what the model actually looks like, and we are looking now at the dashboard. So we are actually looking at those orange and gray parts of the entire graph, which you saw in the last slide. And this is just an example of two of the models, two of the programs, I should say, which the model allows to operate. One is a maternity benefit model, the other one is an old age benefit model. And first of all, you can see, for instance, one can choose right at the top. There's a button which is indicated yes here. You can choose whether this program would be part of your total package. If you choose yes, it will be part of the package. If you choose no, it will not be part of the package, and no costs will be calculated. Then you have a number of choices which vary per program, which sort of list the program parameters. For instance, we can choose whether the benefit will be adjusted each year following earnings or in inflation. We can choose a benefit duration. We can choose a benefit replacement rate. We can choose whether it's linked to the national poverty rate, whether it's linked to an international, one of the international poverty rates. And we can choose a certain phase in. So we can choose whether the program will start next year, or whether it will gradually sort of build up in the next few years. So those are all choices we can make for each of the programs. And then we can see already to the right of the graph, we can see what the costs are displayed as percentages of GDP and as percentages of government spending. Let me not dwell for too long here. Let me please go to the next slide. Because obviously any model will have a number of limitations. And one important limitation to mention is that we had to assume in the model that all programs will be perfectly targeted. So there will be a target benefit population, and we haven't assumed any inclusion or exclusion errors, so to say. So all the benefits will flow on a one-to-one basis to the target group, so to say. So that's a very important limitation, because obviously we know that there's quite a lot of spillage in real world programs. So there will be groups who will benefit from certain programs which are not in the target group, and there will also be groups which miss out, basically, which are not reached by a program. So this is something obviously when we look at the findings of the model, we will have to take into account. So that's an important limitation. And one more limitation to mention is that we are still sort of working on some parts of the model. So we're still, for instance, working on the government finances module, which allows us to look more in depth in the relationship between social protection financing and government finances, which would be the case in a genuine social budgeting model. So those are things which are still on the to-do list, so to say. Can we go to the next slide, please? Yeah, so like Anand already mentioned, there are three stages, three phases which the model allows us to operate. One is the emergency phase right after the occurrence of the COVID-19 shock, so the 2020 measures. Then there's a recovery or transition stage, 2021-2023, when governments gradually phase out certain programs and also phase out some of their financing of the programs. And then the third stage, so to say, the model allows us to simulate is the build-up to a social protection floor, which can meet the SDG 2030 targets, and which can be tailored to the needs and the wishes of each country. Okay, we can go to the next slide, please. Okay, and that's, I think, where no, that's not yet where I hand over to Anand. Yes, please, next slide. Yeah, so basically this is very brief. I'm not going to list everything which is on the slides here, but this is to show what the three packages for the three phases incorporate. So you can see there's quite a lot of measures which have been simulated. You can see the age groups, you can see the level and the duration of the benefits, and you can see what we have assumed in terms of administration costs. Next slide, please, which lists the same assumptions for the recovery phase. And the third slide, next slide, please, lists the assumptions for the social protection floor package, which already, as you can see, is quite a comprehensive package of social insurance, social assistance, and active labor market policies for a large variety of groups. But as you could see from the modeling architecture and the dashboards, one can choose different sets of programs, and one can choose different parameter settings. But these are the ones which we used for our study. And now I think I can hand over the floor back to Anand to share with you our findings. Thank you.
Thank you so much, Arthur. In the interest of time, let me just keep this part brief. Can we go to the next slide? So we present the results in two sets. One is for the additional costs, which is the emergency and recovery and transition phases, and another set of results for the social protection floor space. So this slide kind of shows you the estimated additional costs for the emergency and the end of the transition phase, which is at 2023. So if you're able to look at the table, yeah. So for Asia and the Pacific, on average, the cost for the emergency package is estimated to be around 3% of GDP over the transition period. While there is some changes in the transition package in itself, the costs are estimated to go up to about 3.21% of GDP at the end of the transition phase. Several countries, as you can see from the graph, show costs that are way higher than the regional average, while some register costs which are way below. And the average does hide a lot of the variations, and the variations could be driven by a lot of factors within each country. If we look at the income groups, among the upper middle income groups, the emergency package is estimated to cost around 2.4% of GDP, and it's most expensive in the low income countries at around 6% of GDP, going up to about 7.9% of GDP in 2023. Similarly, if we look at the different sub-regions, we have the highest cost registered in Central and West Asian countries at around 3.97% of GDP, and the lowest cost, at least for the emergency phase, listed in East Asia. So we'll go in a little bit in depth into how these costs evolve across the income groups and across the different regions in the next couple of slides. Can we go to the next slide, please? So this slide essentially presents the programs driving the costs in each of these through these years for the different phases. So essentially, if you look at the emergency phase, for example, the emergency phase contains a lot of large emergency programs, like, for example, the wage subsidy, which is estimated to be the most expensive program through this phase. Similarly, we have the health insurance contribution waiver, which includes both the social insurance and social assistance programs, which are estimated to incur high costs. When we go into the transition phase, some of these larger emergency programs are left behind to be replaced by activation measures to help through the recovery. Although the cost of labor market programs or the activation measures here, for example, you have public works and employment guarantee programs and skill development and training programs. The cost of these programs don't seem to be way too high, but what seems to be dominating the cost still are the cash transfers, as you can see, which is the yellow section in the graphs, as well as the health insurance contribution waivers. The cost to the government, so this is also another, it's something that's programmed into the model. It's an assumption that at least in the emergency phase, the costs are going to be completely financed by the government. And as we move into the recovery, the system will slowly resume back to being contribution financed. So that's one of the reasons why you observe that the cost to the government reduces gradually over time. Can we go to the next slide, please? So this slide takes a little bit closer look at the distribution by income group and the sub-regions. As we went through before, the highest costs are registered among the low income countries. And And within the sub-regions, we have Central and West Asian countries registering the highest cost. The programs driving these costs are different for each one of them. For low-income countries, for example, one of the reasons why the costs are so high is because of a per capita GDP, which is very close to the national poverty line, which means that the average benefit size is quite expensive per capita, which makes programs quite expensive in low-income countries, and as a result, overall, the expenditure patterns go up. Okay. We can go to the next slide. So this is another example of how the SPRS 20 probably gives results. So what we've done here is to present the beneficial distributions, but as shares of overall the shares of male to female, urban, rural, poor, and non-poor. This can be presented in different ways. SPRS 20 also gives you absolute numbers. For example, what can be observed from here is that if you look at the emergency programs and the ones that are not particularly targeted at the poor, we see that the poor don't benefit too well from the emergency programs, other than cash transfers and programs as such, which are directly targeted at them. Similarly, if you look at programs that are targeted through labor market provisions, like, for example, targeted at specific occupations, women don't seem to benefit very well from such programs. So these gives you hints about things that have to be kept in mind when administering emergency benefits and when administering equitable distribution of available resources within a country. Can we go to the next slide? So the next set of results is for the social protection floors. Next slide, please. For 2024, the social protection floors package is estimated to cost around 4.1% of GDP. And this is around 3.1% of GDP and the remaining 1% is through contributions, 3.1% from the government and 1% financed through contributions. As the graph on the right kind of shows you, the costs are estimated to peak at around 2027-28, and then slowly decreases also. This might also be associated with one of the modeling assumptions that we have, that programs in this phase are slowly phased in and they reach their full maturity as they go over time. And this accompanied with a faster GDP growth, and then the denominator effect of the GDP growth kind of helps project this kind of a pattern for costs in Asia and the Pacific. At the end of the projection period, which is in 2030, the average cost in Asia and the Pacific is estimated around 5.9 or 6% of GDP. Again, low-income countries show the highest cost at around 12.3% of GDP in 2030, and we also have very high cost registered among Pacific countries at around 9% of GDP. The cost driving these we will discuss when we go into the next slides. The next slide, please. So this slide essentially again presents the breakup of programs driving costs. As you can see from the graph, programs such as cash transfers continue to be very high expenditure in 2024. But as we move on to 2030, cash transfers, for example, reduce in cost, and programs like the child benefit and the old age benefits, both universal old age benefit and if you look at the pension benefits, these programs seem to be getting more expensive over time. The labor market programs, again, continue to remain very small contributions in terms of costs. There could be a number of reasons why this is done. Some of them could be modeling assumptions. For example, we assume that the employment guarantee program is phased out at the end of 2030, which is one of the reasons why labor market programs show such low expenditures. Can we go to the next slide? Taking a closer look again at the distribution between income groups and sub-regions, the highest cost again between low-income groups, as we discussed before, among the sub-regions, Pacific countries showing the highest cost during this period. The graphs show you sort of the pattern which could be expected, which is again in line with the pattern that we saw overall in Asia and the Pacific in how costs are unfolding. Next slide, please. Next. Yeah. Taking a look again at the beneficiary distribution, one factor that jumps out immediately is, as we saw in the emergency and the transition package, programs that are not directly targeted at the poor, like for example, the cash transfers, don't seem to be benefiting the poor very well. So this is something that policymakers will really have to take into consideration and keep in mind as they are looking at how programs distribute equitably across the population groups. The rest of the benefit, like for example, the urban-rural split up, at least as part of our modeling assumptions, seems almost 50-50. Again, male and female distributions, there are certain programs that benefit women well. But for example, labor market programs, again, this could be driven by the current state of labor market participation and the projected labor market participation of women in the region. Again, they don't seem to be benefiting women very well, as you can see in the figures here. Next slide, please. So just to quickly round up the kind of observations that we had. I know we had to run through the results quite quickly in the interest of time. But the fact that the cost of social protection systems, the cost to social protection systems is going to be increasing over the coming years, especially considering that large sections of the population are going to be dependent on these systems, given the implications of COVID-19 and the new vulnerabilities that it set upon them. A lot of careful planning, a lot of strategization is required to ensure that countries are prepared to provide the protection that people deserve and they need. And this will require a lot of planning, a lot of political will that needs to be in place to ensure the physical space is made available, and we have enough domestic resource mobilization to ensure that the financing can take place. So SPRS 20 and this report and the results that we presented kind of gives you an example of the kind of knowledge work that we can generate to help countries undertake this planning, also help them weigh different policy options as they go forward and they plan for future shocks. Thank you so much.
Thank you very much, Anand and Arthur. This was a great presentation on a really interesting study. For all of those who haven't read it, I recommend going on ADB website and reading it. It's really interesting. And so this was a really nice sneak peek on the whole study, which is, as I said, again, really, really nice to read. Also, just reminding you, we already received a lot of questions on the Q&A box. So if you want to ask your questions, you can send the questions there, and our panelists, the speakers, they will be answering throughout the presentation, whatever they can, as much as they can. And now I'd also like to invite Celso Basali, because he's been working at ESCOPS on also a simulator on social protection. And I'd like to know a little bit more of what are his own insights on the SPRS as a simulator, but also on their own work that they're developing at ESCOP. So please, the floor is yours.
Thank you very much, Camilla. And let me start by congratulating ADB, particularly Arthur and Anand, for this great initiative and excellent work for this costing model. We can move to the next slide. I'll start with a bit of giving insights or like feedback from our side as users of similar tools, and then I'll, as you suggested, then I'll move into to our simulation model. So I think the first thing is that it's great to see social insurance, social assistance, and ALMPs all together. This gives us a complete picture of the costing of social protection. So I think that that's something that's to be taken into account in using this and like exploiting this tool to its maximum potential. I think it's going to be highly useful for policymakers and also development practitioners when they're trying to, basically sell this idea of extension of social protection coverage to all in Asia Pacific. And I think, program-based approach, I feel is, we prefer that one over other approaches, and I don't see it as a limitation, but I think it gives the user more flexibility and to know, disaggregate different programs and build interesting packages and experiment basically. So that's, I think, a nice feature. that we also followed at ESCAP. I think the phases are very well taught and are largely aligned with SDGs, especially in the 2024-2030 period with ILO convention. So that's great to see this, transition from targeting to universal. That's where we stand as one UN. And in the report, I've also seen the desegregation for some groups, like along gender, residence, poor, non-poor. So that's also a nice feature of the tool to desegregate the national average to different groups. Reporting by sub-region income status, they're all very well taken, and I'm sure people who are at regional level, they'll be benefiting from such tools, options in the tool. Next slide, please. There are a few things that came to mind while reading the paper. I haven't looked into the tool. I'm not sure if it's available online yet, but I only read the paper. I think you've accepted the assumption of the perfect targeting, which is an elusive idea, and it's very difficult to defend. I'll show a picture for the inclusion exclusionaires, and you know this also. So I think like the way we stand is more, moving into universal and not going into targeting. I saw one question in the chat from Bhutan, I think, where there was a poverty targeted scheme. I would kindly, suggest to move into the universal one to the extent it's possible with the budget constraint. Looking at the paper, I'm not sure how the tool will play out, but it might be helpful for the user to have this, different scenarios that they can play with. They might not know exactly, what sort of benefit level, at what level they want to give. We usually tend to think of it in terms of GDP per capita, like % of GDP per capita, and then we quantify it as a monetary value, like you're giving $20 as a child benefit, or $50. I think it might help the user a little bit more to relate to, as opposed to % of international or the poverty line. That's one option that you may want to consider. But also, I think it's in line with the ILO convention, the figures there. I think one thing that came to my mind is that there are existing schemes, and the simulate the costing model is focusing more of these additional packages in line with COVID, but also the long term. And you may be overestimating a little bit the costs. I mean, from the sale point of view, because they are not starting from scratch, and all these packages are not. They already, like, we know that coverage is low in Asia Pacific. We know that spending is not high, but there's still some things going on, and there's still some work going on. So it might be helpful to think about, how is it possible to take into account the existing schemes and then, build upon them. And you rightly acknowledge in the paper that some of the operational costs will be dismal because they're already existing schemes. I think for now, this is from the overall feedback. There's a typo. I recently realized that the 2024-2030 was fully aligned with the SDG and ILO convention. So it's my bad. I think there was a confusion with the cash transfer in general versus some of the social assistance programs, which are still going to the universal, like all children and the people with disabilities. So I'll maybe next slide. I'll start in the next 5 minutes that I have. I've been timing myself also. I'll quickly show a little bit some of the results that come out of our social protection simulator, which has been online for a while, but it's currently going through a major design makeup. So it's going to be much more user-friendly. Hopefully in a couple of months, we'll be able to launch the newer version. Next slide, please. So what we've done is we went a bit through the other side of modeling from the micro side. So we built a static micro simulation model, pretty simple, based on linear approximation. And we use household expenditure surveys for this model. And what we aimed for is to give the user ability to build and compare non-contributory social protection packages. So these are social assistance packages. We don't have any social insurance or contributory social protection schemes in our tool. And what user can do is to analyze different schemes in one country, compare those different schemes, in one country under different scenarios, and also have a bit of a cross-country perspective to see how different programs are impacting different outcomes, as I'll come to cover in a bit. We currently cover 3 programs, 3 schemes, types of schemes: child benefits, disability benefits, and old age benefits. Soon we'll be having maternity benefits included in our tool. And there are a bunch of outcomes that we're interested in, and we produce results for these outcomes. Most notably, poverty and inequality, the cost of these schemes as it's relevant for today now, the coverage, and household consumption. As I explained, we're using household income and expenditure surveys. So it's a micro data that we use. And currently we have 19 countries in Asia Pacific. We are not covering developed Asia Pacific countries, so we're focusing on the developing countries, low income, low middle income, and upper middle income countries in Asia Pacific. Next slide, please. So I'll show you some results in the next couple of slides. But these results are based on, I just want to spend a minute here on the default scenario that we have. What we do is, as I noted, we are focusing on the universal coverage. So for these 3 schemes, for children 0-17, all covered, all people with severe disabilities in line with ILO, and all older people 65 plus. So that's the coverage. We're going universal in this default scenario that you'll see later. Next, the transfer amounts are the global averages that we see countries are spending. For child benefits, it's usually on average 4% GDP per capita. These are the basic benefits, by the way. 14% for disability, and then 16% of GDP per capita for old age benefits. There's no targeting, no pension tested, no poverty tested, and there's standard assumptions on administrative costs and economic growth and population. So I'll now show you a bit of some results based on this scenario. There's sometimes just maybe one word on the benefit levels. There's usually basic benefits and then enhanced benefits. In enhanced benefits, the disability and old age benefits, like in OECD countries, go up to beyond 25%. So that's where sometimes we also take as a different scenario. That's not our default scenario. And but we observe that child benefits are still 4% per GDP per capita, even in OECD countries. Next slide, please. I'll start with the most interesting, I mean, not most interesting, but the one that's usually sought after. So the impact on poverty in Asia Pacific. Maybe a little bit, the legend is not showing there, sorry about that. So here you can see the impact on poverty based on that default scenario of social protection package, 3 schemes, universal at those levels of benefits. And there's a wide range with like over 70% reduction in international poverty line in Thailand and in Sri Lanka, while it's around 10%, a bit over 10% in Bangladesh. And the blue bar is the basic benefit, the orange dots are the enhanced benefit. The difference is not that high because it's covering mostly the old age and disability. If we were to increase child benefits a little bit, the enhanced benefits would result in much higher poverty reduction rates. Next slide, please. So then on inequality, usually we focus on Gini, but for this, I wanted to focus on Palma ratio, which compares the top 10 income versus the bottom 40. And here what we see is that there's again a wide variation from 29% decrease in inequality to just 4% in Armenia, with an average of 14% reduction in inequality. We produce these results for different indices, inequality indices, Gini, quantile, and Palma ratio. Next, please. The main mechanism of our simulation tool is that we have the household expenditure survey. We know the households, we know their conditions, all their demographics, and we're just giving them this additional income, and we are boosting their consumption. So with that boost, there's no savings. and the consumption basically decreases poverty and contributes to reduction in inequality as well. So as opposed to what the result was shown from the SPSR 20, we see that the bottom 40 is getting the consumption boost in our non-contributory schemes. So usually they can be like twofold, twice more consumption boost, or it can be up to ninefold increase in bottom 40's consumption in relation to the top 10. So we're seeing that in universal packages, the poorer households are benefiting from non-contributory social protection schemes a lot. Next, please. Now, in terms of coverage, so here we compare where we are, which is the blue bar, and where we can be. So the blue bar is coming from ILO's social protection database. For Asia Pacific, it's just around 50%, with China included. If you exclude China, that's around 32%, I think, coverage. So the scenario that I showed you, if you do that, then you would arrive at the orange dot. So for majority of the countries, there's a huge coverage boost in case we go with the default basic scenario. There are a few countries where it's spot on, like Turkey and Cook Islands, but there are also others like Georgia and Mongolia, which is actually giving currently much more than what we have given them in our simulation. But yeah, for majority, there would be a huge boost in coverage, basically coming between 85 to 95% coverage rate. Next slide, please. And I think here I can maybe show, I just wanted to show, this is only for not the combined 3 packages, but just child benefits. If you were to, as opposed to, or how to say, if you move from universal to poverty means targeted scheme, the share of eligible children excluded is shown here. So imagine that you moved from universal to a targeted scheme, which is considering only bottom 40 of the household consumption deciles. And there, on average, you could, in Asia Pacific, basically exclude about a third of children, eligible children from, and this can go up to 56%. I think there was one, Samir, I saw his comment for Indonesia. Indonesia, yeah, we have around 32% in Indonesia, the exclusionary. And I don't know if you guys have gotten the same number, but our simulation tool shows that we want to basically move away from targeting. And this is only exclusion. Then we have the inclusion areas also. We can show them by deciles. Next slide, please. And I think we're just ending. Sorry, I stepped a bit out. Thank you. So here the cost, the most relevant one. So our costs are, even though we are giving just 3 packages, our costs are a bit higher than what we've seen with ADB, which is very complete. But it might be because of the coverage, or it could be because of the higher benefit levels. I'm not sure if ours are much higher, but the percent GDP coverage basically ranges from a bit above 2% to above 4% of GDP. And currently, I think, according to ILO, it's around 5% of GDP in Asia Pacific. There are some countries which are going also much higher than that. But this is where we see the distribution of Asia Pacific countries. And in most of them, child benefits, the blue part of the bars are taking the biggest share of this cost. But in some others, as aging is hitting, we are seeing more and more old age pensions taking the heavy burden of the cost of these programs. Next slide, please. Yeah, that's it. Thank you so much.
Thank you so much, Salsa. It's really interesting to see how different simulators from different international organizations can complement each other into giving us a little bit more of a comprehensive view on social protection and its costs, but also their impact. So it's really nice to see this this holistic view that can be provided by using different simulators in collaboration. So speaking on impacts of COVID-19, I'd also like to invite Samir to provide us with a little bit more on the impacts of the COVID-19 on the labor markets and how social protection was used to mitigate those effects, its importance. So please, Samir, go ahead.
Okay. Thank you, Camilla. This is a joint work with 3 other colleagues of mine who we worked together on this. The report was launched in December. Please, I encourage you to look at the report closely, but I'm going to try to give a summary of what's in there, but focusing more on the social protection angle. Next slide, please. First, I'll start with the context, which, of course, we all know what the context is, but just to kind of highlight those five countries we have looked at, and some of the key questions we have tried to answer in this work. And I'll go over the data and methods that we have used. And then some of the main findings, there's a lot in there, but some key main findings that I have highlighted here. First one is about impact channels and aggregate effects. And then going into transitions across labor force status by age and sex cohorts, which is quite important because we see some interesting results when you compare men and women. Then I will look at the transition within employment, labor reallocation and sectoral effects. And then what I'll do is also talk about the intensive margins of adjustment, because job loss itself doesn't really quite capture the overall impact of COVID-19 on labor markets. It's important to look at the reduction in hours as well for those who are still employed. And then lastly, sort of differential impacts across workers and firms. And then I'll look at what policies have mitigated the impact. And here I'll go into social protection measures. Next slide, please. So the context, of course, is it's COVID-19. Here, the 2 questions we have tried to answer. The first is, how did labor markets in Southeast Asia adjust to the shock, and who has been hurt the most? And here, the 5 countries we have looked at: Indonesia, Malaysia, Philippines, Thailand, and Vietnam. This is also for a reason why we looked at these 5 countries, is because we have relatively up-to-date, reliable labor force surveys that we can use. In most countries, we've got quarterly labor force survey, but in case of Indonesia, we have twice a year. In terms of the time period, just so that it is clear that the period is 2020 and then the first quarter of 2021. We still haven't looked at the rest of 2021, and as we know, the pandemic is not over yet. And then, what policies have mitigated the impact. Here again, there are all sorts of different kinds of policies that are put in place. But what I'll do is I'll give you a snapshot of the social protection responses. What we have tried to do here is just to juxtapose policies and then with labor market impacts and adjustment patterns. As you know, to do a sort of a thorough analysis of what worked, what didn't work, during the pandemic, we have to have more data, and we have to do a bit more analytical work before we can really say what had the most impact in terms of positive impact in terms of mitigating the labor market impact. But what I'll do is I'll just sort of show you a sort of, you could say, a correlation between policy response and labor market adjustments. Next slide, please. In terms of data, as I mentioned, we have used LFS for the 5 countries. In some cases, we have had to get the data from NSOs, but our ADB's statistics division within the research department does a great job of collecting microdata for these countries. And as I said, Indonesia, it's biannual, February and August. Some supplementary sources we have used, of course, depending on what questions we have tried to answer, and I'll go over them later. In terms of data on social protection, this will sound familiar to folks who know this space very well. The first one is ILO's social protection report, the recent one that came out late last year, and also the World Bank's Aspire database. And then we've also made use of the IPC database as well on IPC, the International Policy Center for Inclusive Growth, the database on social protection response to COVID-19 in the Global South as well. Next slide, please. So in terms of the methods, just quickly, we have made use of pseudo panels that have been constructed by sex and age cohorts to follow the progression of demographic groups across labor force status and then transitions within employment across quarters, mostly in 2020 and early 2021. We have disaggregated impacts along various dimensions to identify vulnerable affected groups. So informal, formal, we've differentiated that as well, and type of work arrangement, temporary, short-term daily workers, and also occupational group and skill level, and enterprise size as well, but we don't really go too much into it in the report. We decompose total working hour loss, as I said earlier, looking at both intensive and extensive margins of adjustment. Extensive margin being job loss, intensive margin meaning hours reduced. And we also look at what factors contributed to use of intensive margins, for example, some preliminary evidence on that front. Next slide, please. So the key findings, the first set of findings, next slide. Again, so this, of course, now we are almost 2 years away from the height of the pandemic in Q2, Q1, Q2, late Q1, early Q2 2020. But again, so please look at it from that perspective of things have improved. But at that time, of course, it was much more dire. COVID-19 impacts, they have differed across countries in terms of scale and shape. Driven by context and institutional factors. Let's take an example of Philippines, the top left there. I hope you can see the graph. I know it's a bit, the fonts are a bit small, but here what we have done is that, so the green, red, and blue, what they're referring to as green is sort of transition out of employment. So those are negative numbers. You can see minus 12.5 in that quarter. So unemployment is the red ones, which are sort of transition into unemployment. So folks who left employment went into unemployment. And then some of those folks exited the labor force, which is the blue slice you see there. So when you use that, you can see that, of course, the peak of the pandemic in case the Philippines was Q2 2020, and then also Q3 2020 as well, and things improved in the rest of the year, particularly in Q1 2021. The lines you're seeing there, so the stepped line, this is the stringency index. And then you've got the pink area there, which is the total cases per million. This is total COVID-19 cases. Of course, the picture is very different right now. If you had to redo this, it would look a bit different at this stage. But it will be interesting to do that later on. So among these countries, Philippines is the one that sort of stands out. So I'm going to just leave it with that and go to the next slide. So next slide, again, there's Thailand and Vietnam at the top. But the table that I've included there on the key labor market indicators, and here this is very interesting to look at. A lot of times when you just focus on unemployment rate, which is you see the UR, that's unemployment rate. And of course, as you can imagine, a country with a large informal sector, unemployment rate usually is not that informative as it usually is in an advanced country context. But what I like here is the employment to population ratio. This is your employment rate. If you look at that, the employment to population ratio hasn't quite recovered to pre-pandemic levels. Of course, when we revise these figures, it might look different, and my colleague from ILO, Christian, might have some updated numbers on this from ILO's model estimates. But when you look at these data from LFS, you see that the employment to population ratio hasn't quite recovered. If you look at a place like the Philippines, for example, you compare from Q1 2020 to Q2 2020, you see that it declined from 58.4% to 45.9%. So you can imagine the hit that the labor market took in the Philippines. The story is not quite as stark in other countries, but still, nonetheless, the impact has been pretty drastic. Labor force participation rate, the LFPR that you see there, it's also an important indicator. A labor force participation rate has declined in several countries as well because of the pandemic. Next slide, please. Next slide. So we look at the transitions now by age and sex cohorts. I'll spend a bit of time here. So here, as I said, job losses peaked in Q2 2020 with significant declines for all age and sex cohorts. What is interesting is that if you look at the exits from the labor force, those gray slice of the bars that you see for each of the pictures there, if you take an example of Indonesia, for example, so you compare male with female, and again, so the blue ones are all negative numbers, and then the orange and the gray ones are all positive numbers. So blue people leaving employment, orange and gray, people going into either unemployment or exiting the labor force. What stands out, if you take a close look, is that for a lot of women, they actually exited the labor force after a job loss. And especially stark, you see Thailand and Vietnam there, and even in the younger age cohort. And one of the things we pointed out in the study is that as we know, the burden of care, again, and ILO recently, the Director General of the ILO also pointed out that this particular aspect of the pandemic is that the burden of care usually it tends to fall on women. And in this case, we have seen it very starkly when we look at the data that indeed that they have borne the care burden much more than men have during the pandemic. Moving on to the next slide, please. Yeah, this one, the youth. So youth share in job losses also is higher than the share in employment across most heavily affected sectors. And this is another interesting finding from this study. I picked out Philippines there just to look at the education sector. If you look at those two bars there, so 17% is the youth share in employment in Q4 2019, so pre-pandemic. 51% is the youth share of job losses in Q2 2020, so during the pandemic. You can see that they were the ones who were affected heavily by the job losses. And it's particularly interesting looking at education, right? Because of course this is related to lockdowns, schools being closed, a lot of the young teachers were let go. So hence we see this type of picture. When you look at the other countries, Vietnam, Thailand, Indonesia, one sector I wanted to point out is the manufacturing sector, and I'll get into it in a second. Manufacturing sector, if you look at that, the first set of bars there in each picture there, 18% in case of Vietnam, 18% of youth share in terms of total employment in that sector. So youth were 18% pre-pandemic, but in terms of job losses, over 50%, 54%. Similar is the story in Thailand, also in Indonesia. And you look at other sectors, you see a similar picture. Next slide, please. And one of the things that when we were working on this, it was very interesting to see whether the detachment among women is actually something that's permanent, right? And of course, I mean, you can imagine a lot of it is cyclical because the crisis. So again, women were quicker to re-enter the labor market. And you might say, oh, this is actually good news. So they left during the height of the pandemic and they came back as the labor market recovered. Well, the story is a bit more complicated than that. And I'll get into that in a second. Just to point out, in case of Malaysia, we don't see the picture as clear as we see in other countries. But nonetheless, this exit from the labor force and then going back into the labor force, somebody might say, "Oh, there's no bad news here." But I will share some findings that might indicate a different story. Next slide, please. Next one again. Okay, so here, this is the sectoral labor reallocation, right, in Q2 2020 compared to Q1 2020. Again, so the hard hit sectors included those that would normally absorb displaced labor, so wholesale and retail trade, accommodation and food services, construction, transport and storage and other services, and even agriculture, right? So if you think about it, during a financial crisis, when you look at the last financial crisis, when we go back to say Asian financial crisis, or even during the 2008, 2009 crisis, which didn't affect Asia as much, but we can still see what happened in terms of sectoral labor reallocation. And you see that during times of crisis, when folks lose jobs, say from manufacturing, where they're wage and salaried employed, where they earn a wage and salary, which is a better type of job. After a job loss, they tend to go into low productivity sectors like agriculture, wholesale and retail trade, go into self-employment. Again, this time around, that happened less. And you might wonder, why is that? Well, the main reason is because of the stringency of lockdown measures. Because of the public health crisis, some of the lockdown measures were quite strict, especially when the one country that I know a bit better, having the experience of living there, also is the Philippines, where you see that the lockdown measures were quite strict. So folks who lost their jobs couldn't quite re-enter into, say, agriculture, right? The low productivity sector, or wholesale and retail trade. Things improved towards the second half of 2020, but nonetheless, at the peak of the crisis, they couldn't quite go into low productivity jobs. And again, if you look at this chart, you see that agriculture, manufacturing, accommodation, and food service were, of course, they were some of the most affected sectors. Accommodation and food service, there's a lot of personal contact in this sector, and because of lockdown measures, because of the pandemic, of course, this sector was heavily affected. And the manufacturing sector, again, it's a very interesting finding, because that's usually tends to be a good type of job in that sector. So a lot of workers in that sector were affected. When you look at Indonesia, for example, 27% of all job losses were in the manufacturing sector. Again, that's a very, very big impact. Next slide, please. And as I said, mobility restrictions and other containment measures, they limited labor reallocation. When you look at this chart, we have sort of indexed this to 2019. And then you look at this chart, you see that some of the sectors haven't quite recovered in these 4 countries. Some have recovered, some haven't quite recovered so far. And the recovery, of course, has also been related to or tied to the lockdown measures. Next slide, please. So in here, this is where I'm going to spend a bit of time, because what I said earlier was that, the women re-entered the labor force after, say, the peak of the pandemic, right? And that's true. So as it turns out, when you look at this table here, we have employment recovery in Q3. Here, as we see, the recovery has been in mostly lower quality jobs, so movements into self-employment, on-account workers, which is typically your informal employment, and then unpaid family workers as well. So here, if you look at this table, one column that's particularly interesting is the self-employed. If you look at the self-employed, you see that 32% of job gains was in self-employed. What that basically means is that a lot of the folks went into lower quality employment, right? And unpaid family work, again, you see a lot of the workers also went into that type of labor market or labor force status. So again, recovery, there has been recovery, but not in the good type of jobs as we would like. Next slide, please. Next slide again. So here again, so at the beginning, as I said, when we look at job loss, it only gives you a partial picture of the labor market impact. If you want to look at the full picture, you also need to look at the hours reduced for folks that were still working, right? And what I've presented here is a table that looks at the decomposition of working hour losses. And here we are presenting intensive margins of adjustment. As it turns out, across different sectors, intensive margins of adjustment, meaning hours being reduced, were used in all sectors in all 4 countries. Of course, there's variation depending on the country and sector, but nonetheless, they were used across different sectors. Next slide, please. And what we try to do here is that, and this is what I mentioned earlier, looking at sort of some of the correlation type exercise. What we try to do here is that to which extent intensive margins of adjustments dominated in different countries, looking into particular sort of factors, right? For example, one is teleworkability of your occupation, micro, small, and medium enterprise share, temporary worker share, wage employment share, or low skilled work share. And here the story is not as quite, of course, it's a correlation exercise, so it has its limitations. The story is not quite as clear. One thing I can tell you, if you eyeball the table, that you will be able to see is that, so wage and employment share, when you look at the teleworkability index, you see that, of course, a lot of the wage and salaried employment are your typically good jobs, as the ILO actually, going by their definition, by just looking at the wages. So that type of employment is, it's a better type of employment. There, a lot of the work could be done from home or in front of a computer, like we are doing. So that is the prevalence of that is higher. There we see the strong sort of a correlation. Elsewhere, we don't see this. This work is we are continuing this work as we go forward. Next slide, please. It's a work in progress still. So here, just quickly before I go into social protection, I don't know how much time I have left, but on the type of skilled workers. Here again, the pandemic has hurt low skilled workers, but also middle skilled workers. If you look at the weighted average, the second row and the last picture there, last pie chart. So we've got skilled, semi-skilled, and low skilled, and those are the broad occupations that you see at the bottom. So as it turns out, and it doesn't come as a surprise to most of you, I imagine, is that low skilled and semi-skilled workers were the ones most affected by the pandemic. And even when you go into that, you will see that some of the sectors that were more affected are, you see the clerical support workers, even service and sales workers. Service and sales workers are usually in the middle skill category. Next slide, please. And again, just to summarize this, the types of workers that were affected: on account workers, informal workers, temporary and casual workers, and migrant workers. We don't get too much into migrant workers, but we know this from other work that the ADB has done, and also the work that ILO and others have done as well. Next slide, please. Now I'm going to spend a bit of time on social protection measures. Next slide. So going back to what SELSHA, the social protection tracker at SCAP has developed, and also the SPRS 20 that Arthur and Anand presented, very interesting models. So we'll be reaching out to you, especially it's relevant for ADB's operations when we are actually designing some of the interventions in social protection measures. And here, what I'm showing you is the left-hand side is basically your pre-pandemic social protection coverage. So there's, as you know, there's three main categories: social insurance on the left-hand side, in the middle is your social safety net or social assistance, and the right-hand side is social protection and labor market programs. Doesn't come as a surprise to most of us, I think, is that coverage, of course, is much higher for social safety net because some of the popularity of cash transfer programs that SELSHA and Arthur and Anand, all of them presented. And then you've got social insurance program, which the adequacy of benefits is much higher when it comes to social insurance programs. But of course, the coverage as it is pre-pandemic wasn't as high across these countries we have looked at. On the right-hand side, I have a chart here looking at the proportion of the population protected in at least one area of social protection. There's several areas of social protection. So here you see Asia Pacific average is 39%, and a lot of the countries that we have in our sample are below that, except Thailand. Next slide, please. So here, social assistance programs, and particularly large-scale cash transfer programs, played an integral role in the social response of these countries. And you know this already, but when you look at the left-hand side, the left panel there, here we have picked basically 5 main programs in these countries. So we have PKH from Indonesia. If you look at PKH, the first column, you see that, or Family Hope program, you see that. So what I'm showing there is that the yellow bar slice is the expansion of coverage. Initial coverage is the blue one. And the 81% you see at the top is the 81% of households with decline in income between February and April 2020 relative to the same period in 2019. And the poverty headcount for 2018 data, the red triangle that you see there. So if you go from PKH to looking at social amelioration program, which includes Pantawid and non-Pantawid aspects as well. So here you see the expansion has been tremendous, and ADB actually has also contributed to this during the crisis through our lending support to both Philippines and Indonesia. So you see that there has been a big expansion in terms of some of the social assistance measures. When you go to the right-hand side, looking at the adequacy of benefits for large-scale emergency cash transfers, again, so the blue one is the maximum benefit percentage of average household income, and the yellow bars are maximum benefit percentage of household income of the lowest quintile. So again, of course, depending on the program you're looking at, and Pantawid, the SAP looks better than some of the other programs in our sample. Next slide, please. So here, as you know, the wage and training subsidies, this was in the news a lot during the COVID response measures the countries were putting in place. The wage and training subsidies were put in place, that they played a key role, but not surprisingly, the main finding in our report is that the coverage was rather limited. And when you look at this, the blue bars there are coverage estimates, so percentage of labor force, that's the left axis. And the yellow ones are maximum monthly benefit, percentage of GDP per capita, again, also left axis. Maximum benefit, the gray bar, percentage of average wages, that's also on the left axis. And you've got the red one, which is the maximum benefit amount in PPP on the right axis. Again, I encourage you to look at the report. We have taken a thorough look at the social protection response. Again, it's still descriptive of nature, descriptive in nature, but so we'll get into sort of, doing a proper impact evaluation type work, looking at whether it led to, buffering or mitigating the impact of the pandemic on the labor market. Next slide, please. So again, the next steps here, I would say the main next step that we are working on is the first is, of course, we'll continue this work with the new data that has come in from 2021 to update our analysis. The second is actually the second bullet point there, and hence I mentioned that the work that presented by Salsha and Anand and Arthur are very interesting for us. Is that it will help us sort of provide some country-specific recommendations and entry points for developing and strengthening social protection systems in the region. The last point is on sort of one thing we're doing is also looking at data on robot sales, like from IFR, to see was there more automation during the pandemic? Are there firms automating more? And we're looking at some of those sort of long-term trends as well in terms of how firms and countries are responding to living through this period of the COVID-19 pandemic. That's it from me. Over to you. Thank you. Thank you so much, Camilla.
Thank you so much, Samir. This was a really interesting presentation on the study. And I have to say, if this was an excellent presentation, the study is even more interesting to read. So I also invite everyone to check it out at the ADB website. And it's really interesting to be able to understand the effects of COVID-19 on the labor market with all the specificities you found, because there can be very important lessons to be learned from how COVID-19 affected labor markets and how social protection was used in that sense for the future, to help prepare for future crisis, or even who needs to be protected in a labor market sense. And on that note, I'd like to invite Christian, because he's an economist for ILO whose research is really focused on labor economics. So I think he can provide us with a very interesting overview on his thoughts on the study and also what else ILO is developing on the matter. So please, the floor is yours.
Yeah, thank you so much, Camilla, and also thank you very much, Samir, for your interesting presentation and also the very, very interesting report. Let me also start by saying thanks to the ADB for inviting me to be discussant at this important webinar. So it's really a pleasure and an honor to be here. So if you can just go at the beginning of my presentation, yeah. So in my intervention, what I will basically do first, I will make a couple of general comments about the report that was just presented. Then I will showcase you how I think how relevant this type of work actually is by making some links to our own ILO research. Then I will present you very briefly a couple of trends that perhaps can complement some of the findings of the report and also provide a little bit of an outlook. In the end, I will briefly talk about policies as well, and I'll try to stick to the 10 minutes. So next slide, please. Yeah, so that's how the report looks like. So Camilla already mentioned, it was a very good presentation, and it's also a very, very nicely written report. And let me perhaps start with the first point. So let me emphasize that I do find it actually extremely important that, could you go back, please? Yeah. That I do find it actually extremely important that the ADB comes out with this type of reports to look at the COVID impact and, for example, to highlight that certain groups have been affected more than others. We at the ILO, of course, somehow try to highlight that as well in the research that we are bringing out. But I do think it's very important that the ADB comes out with this type of reports, because I do think that the readership and target audience is perhaps also slightly different. Like, for example, when we think about who our government counterparts are. So for the ILO, we are mainly dealing with the labor ministries Then of course also trade unions and employer associations from the private sector. But then the ADB counterparts are primarily Ministry of Finance, Ministry of Economy. And I do think that it is very important that these issues are highlighted, to this type of audience as well, just to raise awareness and to hopefully really have a higher chance of somehow changing something for the better, really on the ground in those countries. Then point two, just very briefly, I don't really think that I need to repeat what Samir presented. I think there's a lot of interesting stuff and material in that report. You do provide quite a lot of details as well for these countries that you're focusing on. So, and a lot of it is also in line with our findings that we have at the ILO, like on these countries, and actually even at a larger scale, many of the facts that you highlighted actually hold for other countries in Asia Pacific, the wider region as well. The last point that I wanted to make, general comment, is obviously, needless to say, I do think that the topic is extremely relevant, and I do think it remains relevant as a pandemic continues. So I do think it's really very important, to provide this evidence in order to then develop policies on the basis of this evidence, like, for example, social protection policies, to mitigate the impact, but then also to see, how do we move on from this pandemic. So how to show the relevance of the work. So I do think that a good indicator is to what extent it links to some other research that is done in the field. Next slide, please. And I would just like to give you, please, a couple of examples of concrete research projects that we are doing at the ILO. Can you move to the next slide, please? Yeah. Okay, so one factor that I think Samir mentioned quite extensively is the particular impact on women, on female employment. And also you mentioned the role of care responsibilities. And we also at the ILO think that care responsibilities, care duties might have played a role in explaining why women tended to very often actually have a larger impact on employment than men, and also why women tended to go a lot of times into inactivity rather than unemployment. And what we are, for example, currently doing is really to kind of try to quantify, how much of this particular impact on women is actually driven by care responsibilities, because we can make actually some use of the information in the labor force about whether people have children or not. So this information is in there, and I think it's very interesting to explore this information. This is like just one example how we are, let's say, building on results like the ones in your study, to try to dig a bit deeper. Then we also have some research going on the rural-urban labor market gap. I think you mentioned as well the impact on agriculture. And I do think that generally it is quite important to consider the question are rural-urban labor market inequalities actually rising due to this pandemic, or maybe they become less. Then, you focused on results on the manufacturing sector. I think it's also good to dig deeper, because the manufacturing sector, let's say it's big, right? And then, one important sector within manufacturing is garments, especially important in this region. So we do some research on that, also on global supply chains, also on jobs in the retail sector. And also on the labor market transitions in Vietnam, because actually, we are working with the National Statistical Office there, because the labor force survey is actually done as a panel. So I think it's actually great that you constructed pseudo panels for these 5 countries, but actually I think it would be then interesting to compare the results, to actually the actual, using the actual panel data, which is available for Vietnam. It's also available for Thailand. But there, we are still working with the Thai National Statistics Office to hopefully, ask them to share this panel information with us and to make use of it. Next slide, please. So this is just admittedly a little bit of promotion for the ILO, so that we've also done a couple of things and a couple of studies, a bit of research, and I think a lot of it, you're referring to it in your study as well. So yeah, so we have done also some joint work with the ADB focused on youth. So that was, I think, in the, towards the end of 2020, where we looked at the impact specifically on young workers in the Asia and the Pacific region. And then in principle, your study is, let's say, complementing this by providing quite a bit more detail for these few countries that you're focusing on. And I mean, there's a lot of other things that we have worked on that relate in one or the other way to your report, which really shows also, like, you know, like the relevance again what what you and what the ADB has brought out. Next slide, please. Yeah, and now I'm going to show you a couple of trends, like our most recent numbers, which are from our World Employment and Social Outlook Trends report that just came out in January, as well as from the ILO Monitor. Because yeah, I mean, I think you mentioned it as well. Obviously, the crisis has been ongoing, and yeah, so this is just, let's say, to complement some of the findings of your report. Next slide, please. Okay, so these are our latest estimates of working hour losses globally within the Asia Pacific region, but also focused on Southeast Asia specifically, which we define as 10 ASEAN countries plus Timor-Leste. And what we see here is that, well, in 2020, I mean, the impact was very large. So around 8% of working hours were lost globally as well as in the region. But then what is quite interesting is when we focus on 2021 and 2022, so these are our projections. So there we see that we do think that actually Southeast Asia is estimated, and based on the data that we have so far, is estimated actually to have quite a big impact of the COVID pandemic. So yeah, working hour losses. So this are the working hours lost due to job losses, but also due to people that might have kept their job but work less. So this is also the split up that you're using, and I think it makes very much sense. But just, you know, like to give you an idea, like for 2022, so for Southeast Asia, we still estimate or project working hour losses of 3.3%. So this, one may at the first sight think that, well, 3.3%, that's not that large actually relative to 2019. But actually this does correspond to the working time of around 9.5 million of full-time jobs. So if you convert this working time into number of jobs, assuming, you know, like full-time jobs, 48 hours per week, then actually this is a 9.5 million full-time jobs, which is actually really still a lot. So I mean, the pandemic is really far from over, especially in this sub-region. Next slide, please. Yeah, I'm not going to explain so much, because I do think that this chart is pretty self-explanatory. So this does show you employment in Southeast Asia. So our estimates for the recent years and as well our projection for 2022. So we do estimate that actually an employment gap has opened up of around 8 million, a little bit more than 8 million actually, like 8.5 or so. If you compare the actual employment numbers to what we would have expected, you know, in the absence of the pandemic, and we do see that, you know, like this gap is I mean, essentially not closing or almost not closing at all. So this really shows you, you know, like the long-term impacts of the pandemic, which maybe also have some consequence, for policies, for sure have some consequence for policies, as well as, I mean, especially social protection policies as well. Next slide, please. Yeah, and then, I mean, this is one particular issue that I don't think that your report digs into, but I mean, as like, it's not that I say that, you know, like you should have done this, because I think you have a lot of material which is very interesting in that report. So it's just let's say to complement, which is that of course, you know, like these job losses and working hour losses come along with labor income losses, and this in turn leads to increased poverty. So what this shows you is actually the number of workers in extreme and moderate poverty in Southeast Asia. And you do see like this long-term downward trend. And I think, you know, I could go back, I think, to the early 90s, and we would still see a downward trend starting from there, starting at higher levels. But, you know, what we really see is that in 2020, what we estimate is like, I mean, there's clearly like a break in the trend, there is, I mean, it looks small, but actually it's quite remarkable that there is this upward tick in poverty. So there are more workers now in the region that are poor, that are below the internationally agreed poverty lines. Next slide, please. Yeah, and then that kind of gives me opportunity to say that, of course, like policymakers should do something about that. And I mean, they do a lot. They do really. They have put in place unprecedented packages of different types of measures of social assistance and other measures as well. Wage subsidies. I think Samir, you mentioned a couple of those measures. So yeah, I mean, this is, let's say, from the ILO viewpoint, what, let's say, could be, let's say, the whole policy mix that is important, to have in place. Let me just perhaps focus on the first two. So starting with the skills development, because I do think it's also a little bit discussed in your report. So there, what I just wanted to say is that, I mean, of course, this is extremely important. But then, I mean, we have done some research actually before the pandemic on the future work and the policies that countries in the region have put in place. What we very often see is that, there are like these skills programs that really clearly aim to bring the country and the economy to the technological frontier of, industry 4.0 and digitalization, to really be at this frontier. But very often we do think, or we did find that actually, I mean, the beneficiaries of these programs is like a very, very small set of people. And also sometimes you get a little bit of the feeling that, that one can, based on what is written there, very, very easily make out of, let's say, a taxi driver, suddenly a software engineer, or out of, like a food seller on the street, some data scientist. And I mean, this is sometimes there's a little bit of feeling that, these programs are unrealistic. So clearly, I do think that, something might be missing on that front, which is really important to put in place. And then, given also the overall topic of the webinar, what I would like to focus on, and then I will finish, because I think we are already a little bit over time, is about the social protection. So there, I mean, this is obviously also very important. So there, I think the key challenge is to move now from these, let's say, ad hoc social assistance schemes, like these conditional cash transfers, let's say, to some medium, long-term social protection systems that are adequately endowed with the financial resources that really have the coverage that is necessary to bring people to ensure good living standards, and especially to tackle the vulnerability of populations. Because like conditional cash transfers, this is about helping people that are in poverty mainly, right? But then in principle it is already too late, so it's really important actually to have something in place that prevents people and workers from becoming vulnerable to falling into poverty. So this is really I think the big challenge, and I think like within this challenge, like it's really also an issue of getting the government revenues right. So formalization does play an important role. And it's really also about like putting integrated social protection systems into place. Maybe one can learn as well from some best practice examples from within the region, as well as from other parts of the region. And I think a very, very recent initiative is actually put in place by the UN Secretary General, is the Global Accelerator on Jobs and Social Protection for a Just Transition. So this is about like using this window of opportunity to really now make a difference and change things towards the better. The ILO is involved in this, so we have a coordinating role. And we are also in touch with ADB. I know about this, and in the past we had as well some joint activities as well on the topic of social protection. So so we are working on it, and I think perhaps as a last remark, I think like we should really all working together on this in a coordinated manner, ADB, ESCAP, ILO, and also other institutions that are engaged in the field. So that's all from my side, and I hand back to Camilla. Thank you very much.
Thank you very much, Christian. As I said, understanding the labor market is really important when preparing policies, and to understand how social protection needs to behave. And it's really great to see that there are a lot of research being developed on the topics. This is really, really good. I'd also like to thank all the panelists. Unfortunately, we're all well over our time, so I don't think we'll have time for a little additional, more additional questions, but most of the questions on the Q&A box were already answered by our speakers throughout the presentation. So if you want to check it out, if you have a question that wasn't answered, you can check it there. And but yes, that's it. Thank you very much. And just as a final message, I think we need to understand that we're going through right now is a recovery phase. So we're entering the recovery phase of post-COVID. And now it's necessary to see how social protection can be used in this recovery phase and how it can help us prepare for future shocks, and also for the future, you know, as most of the studies said. And these studies are extremely important for governments when they're planning for the future. And it's great to see that they all complement each other. So it's really important that we need collaborative action. So we need international organizations to collaborate amongst themselves and also with governments to try and develop a better social protection system in the future. So I think as a final message, I'd like to invite all stakeholders, so all international organizations, governments, development agencies, to develop research and resources on the topic so we can build a better social protection systems, not only for Asia and the Pacific region, but as a whole for the world. So this is really important. So thank you very much for your participation here and for joining us, and to all the panelists with their amazing studies. And as a final message, please answer the survey we have. We'll send this to you through an email, and so we can, you know, assess how to make this webinars a better experience for you. So thank you very much, everyone. And I wish you all a great day and a great week.
Thank you. Bye-bye.
Thank you.
Thank you. Take care.
Thank you.